So we all have spoken favorably about the behavioral health response teams and this diversion program. But it's a pilot, and part of the reason it's a pilot is to see where the gaps are. And so, you know, it breaks down into ensuring that there is someone to call, that there's someone to respond, and that there's some place to go. There's now someone to call. Not just 911, but also the new federal government 988, which we need to continue to educate people on. And by the way, as Rhode Islanders, we should be very proud because what was Rhode Island's BH link is very much embedded in what is now the nationwide 988. And we should be proud of that as a policy leader on the national level. There is someone to call. For the most part, there is someone to respond. Through 988, we need to do a better job of making sure that there is someone to respond locally at 911 at all hours. The gaps are going to come with somewhere to go. And so that's what this pilot is for, is to understand where there are gaps in the referral network, where we are short. We know there's going to be shortfalls, and that's where those resources need to go. And the mayor needs to be, and this is broader than just the diversion program, but generally speaking, the mayor of Providence, which has always had resource constraints, a shortage of money, needs to be a master at trying to both maximize city resources, try to marshal as many state resources as possible, bring foundations and philanthropy to the table to, as a community, fill these gaps. And some funding may come from the city, and some may come from the state, and some may have to come from the Rhode Island Foundation to fill these gaps. And so that's why this pilot is so important, to see where the gaps exist, and then to triage, like the work that everyone who's working hard as a provider in this room, who's running a nonprofit, is doing on a daily basis. On the city level, in the mayor's office, it's just a bigger scale of a very similar challenge. And so that's where I'll be focused.